Low back pain is a common disorder. Almost every person experiences lower back pain at some point of life. Low back pain is more common among people aged between 40 and 80 years, but it begins more young age. Pain can be dull and constant, or sudden and sharp, stabbing or shooting sensation. The pain may make it hard to move or maintain standing position straight. Back pain may worsen with certain movements, such as raising a leg, or positions such as sitting or standing. Sometimes pain radiating down the legs, known as sciatica. Low back pain is acute if it lasts less than 6 weeks. Up to 12 weeks it is subacute. More than 12 weeks is chronic. According to underlying causes, lower back pain may be mechanical, non-mechanical, or referred pain. Causes. Most common cause of lower back pain is mechanical problems such as muscle or ligament strain. Repeated heavy lifting or a sudden awkward movement can strain back muscles and spinal ligaments. Intravertebral disc herniation. If low back pain is caused by damaged intervertebral discs, and the straight leg raise test is useful to identify this cause, with the patient lying down on their back. The examiner lifts the patient's leg while the knee is straight. If pain occurs when the straight leg is at an angle of between 30 and 70 degrees, then the test is positive and a herniated disc is a possible cause of the pain. Arthritis. Arthritis in the spine can lead to a narrowing of the space around the spinal cord, a condition called spinal stenosis. Sciatica. Pain going down the leg from the lower back. Onset is often sudden following activities like heavy lifting or exercising. Caused by muscle strain and vertebral disc compression of the sciatic nerve. Osteoporosis. Your spine's vertebrae can develop painful fractures if your bones become porous and brittle. Other causes of back pain includes inflammatory, including ankylosing spondylitis, reactive arthritis, psoriatic arthritis, and inflammatory bowel disease. Malignancy, bone metastasis from lung, breast, prostate, thyroid, among others. Infectious, osteomyelitis, abscess. Red flags include such as unexplained weight loss, fever, or significant problems with feeling or movement. Risk factors. Age, lack of exercise. Weak, unused muscles in your back and abdomen might lead to back pain. Excess weight stresses and compress the spinal cord. Improper lifting weights. Smoking increases the risk of osteoporosis. Diagnosis. While most low back pain is caused by muscle and joint problems, this cause must be separated from neurological problems, spinal tumors, fracture of the spine, and infections, among others. MRI is slightly better than CT for identifying disc disease. The two technologies are equally useful for diagnosing spinal stenosis. Prevention. Exercise appears to be useful for preventing low back pain. Use medium firm mattresses. Back belts may have some effectiveness. Normal activity should be continued as much as the pain allows. Don't slouch. Maintain a neutral pelvic position. Good posture can reduce the stress on back muscles. Avoid heavy lifting, if possible, but if you must lift something heavy, let your legs do the work. Keep your back straight, no twisting, and bend only at the knees. Hold the load close to your body. Find a lifting partner if the object is heavy or awkward. Most people with acute or subacute low back pain improve over time no matter the treatment. Recommendations include remaining active, avoiding activity that worsens the pain. Non-medication-based treatments include superficial heat, massage, acupuncture, or spinal manipulation. Non-steroidal anti-inflammatory drugs used if these are not sufficiently effective. With respect to safety, naproxen may be best. Skeletal muscle relaxants are also effective. Increasing general physical activity has been recommended. Aerobic exercises like progressive walking appears useful for subacute and acute low back pain, is strongly recommended for chronic low back pain, and is recommended after surgery. Paracetamol, acetaminophen, is not effective for back pain. Surgery may be useful in those with a herniated disc that is causing significant pain radiating into the leg, significant leg weakness, bladder problems, or loss of bowel control. Prognosis. Overall, the outcome for acute low back pain is positive, with complete recovery reported by 40 to 90%.